So it's a real privilege to be presenting on behalf of the orthopaedic department, really as the kind of spokesperson for all the work that's been done over the years. I've used the template I was given to prepare this talk, but I can't quite get used to the term orthopaedic next to this device, which is apparently called a stethoscope, so I just amended it to something more appropriate. So I thought I'd begin with a very brief overview of the department and where we've come from in what is a relatively short period of time. So it started back in 2003 with this individual here, Mr. Andrew Kinnemouth, who came from the Glasgow Royal Infirmary with a very clear vision to create a centre of excellence in orthopaedic with a national reputation. And 13 years later, the department has grown significantly to 15 full-time consultants. I wasn't there the day the photograph was taken, so I've professionally photoshopped this. And so we've expanded significantly. And earlier this year, the Scottish Arthroplasty Project report came out, and it basically showed that we're not only one of the largest, well, the largest unit in Scotland and one of the largest in the UK, but we also have amongst the best outcomes and the lowest complication rate. So I think that is a real sort of testament to the vision of Andy Kinnemouth. And I think it's fair to say that an important part of our unit was research, and I hopefully show you that research has underpinned a lot of what we do day to day, our clinical practice. And I think that's one of the reasons we've enjoyed such success, rather than just being a high volume centre that does joint replacements. So of course the consultants can't take all the credit. We have built a strong base of research support staff over the years. Recently appointed a motion analysis coordinator who will start early next year. And in addition to that, we have a number of fellow students who rotated through the units, doing fantastic research with links with Glasgow University. Recently set up a special studies module in orthopaedic research, which appears to be surprisingly popular. I guess because certainly in Scotland, the west of Scotland, the terms orthopaedic and research tend to not be used together often. So it's something that we offer as a unit. And of course we have very well established links with the University of Strathclyde, and I'm pleased to see Professor Rowe in the audience today, he heads up the rehabilitation group. So we keep a database of all some of our achievements and our outputs, and of course over the years we've had multiple awards, higher degrees, including my own PhD, proud to say, multiple papers, presentations and lectures. But I think the key thing is that clinical practice and patients has been really very much at the heart of what we do, and this is obviously one of the mission statements of the Golden Jubilee Hospital in general. Fred Picard organised a meeting earlier this year, which was a showcase of all that or a lot of what we've achieved over the past decade, and really just included this to highlight the sheer number of projects that have been carried out. And so today, with the time constraints, I won't be able to obviously talk about all of these, but this is just to sort of highlight the amount of research that we're carrying out. So just to talk about some of the big themes, and again going back to Fred, we're very fortunate to have Fred here as one of the truly global pioneers in the field of computer-assisted surgery, and we're one of I think about 15 or 16 reference centres internationally, the only one in the UK. So our aim is always to be at the forefront of this technology, and a lot of our research is in this field. I've chosen really just examples of some of the type of research that we've done that's had an impact and sort of changed practice. And this was going back to when I first came to the unit as a trainee and wanted to get involved in research. And so really this research was looking at the technology and how we could use it to aid surgeons in making intraoperative decisions, and we published work to show that this can narrow the range of outcomes in surgery. And we were amongst the first groups in the world to publish work of this kind. I took this further and took up the challenge of trying to adapt this technology from the theatre into the clinic, and got involved in research in the University of Strathclyde, developing technology, validating it prior to an ethically approved trial here at the Golden Jubilee Hospital. And again, we were the first group in the world to show that you can use, to prove that this technology can be used in an outpatient clinic. And to date, it's not been replicated by any other centre. Of course, we've published it, and this work I wrote up towards my own PhD in the University of Strathclyde. At that time, I came here as a trainee from the orthopaedic rotation, and because of the success that I'd had, that sort of paved the way for other fellows to come. And so David Russell, who's currently here, returned as a senior fellow. He continued the work, this time collaborating with the University of Glasgow in the anatomy department, and further developed the technology to measuring the knee movement in terms of looking at potential applications to soft tissue injuries, and again published his work and wrote up towards his MD thesis. And with this technology and not being available anywhere else globally, is opportunity to measure knee kinematics on patients or on healthy subjects. And so one of my colleagues, Kamal Deep, went across to India and visited 6 centres and basically measured a lot of healthy controls, really trying to answer the question, what is normal knee laxity? The theme of non-invasive technology is something that we do a lot of work in the department, not just what I was involved with myself. And this is a device, it's accelerometer-based technology that can measure range of motion, and it can be used remotely, so we can keep track of what our patients are doing. And this is a project that Fred Picard and one of my other colleagues, Finlay Welsh, involved in a pilot study, and this featured recently on Reporting Scotland. There's a feature on this, and the plan is to conduct a larger randomised trial, so the ethics application has been submitted for this. And it feeds in quite nicely with the growing area of telemedicine and virtual clinics. And I was just speaking to my colleague Jason Roberts, who's a clinical lead, and he was presenting at a meeting yesterday to very senior folk in Scottish Government on this technology. This is a huge area of growth, and he was presenting pilot work that we carried out at the hospital, so we're hoping to then take this further and to lead in this area of telemedicine. So other areas to talk about are wound care. And this, when I was first here about a decade ago, wound problems were not an uncommon feature following elective joint replacement. And traditionally, wound care was seen as a nursing type problem rather than something that orthopaedic surgeons involved with. And at the time, one of our tissue viability nurses, Sue Emerson, took the lead on this and initiated some research and looked at different combinations of dressings to try and get around the problem, the post-operative wound problem, and carried out a pilot study. We call this Jubilee method, and the name stuck. This was backed up again by evidence-based medicine, exploiting our links with Biomedical Engineering Department at the University of Strathclyde, and then also a clinical trial which showed that we could reduce the type of wound problems that we were seeing post-operatively. And this work was published, and the dressing design that we came up with has been implemented in centres, and not just nationally but globally, and it really has changed outcomes for patients. So it's very much an example of a patient-driven problem. Another important area of research has been enhanced recovery, and you heard a bit about this earlier in the anaesthetic talk, and because it really is a kind of multidisciplinary problem, and David McDonald, who's here, has been instrumental in leading some of this research, and so it really highlights the multidisciplinary and evidence-based nature of the research. An element of it is high-volume local anaesthetic infiltration. Again, it's exploiting our links with the University of Glasgow. We performed a cadaveric study to show the best, or where the local anaesthetic goes and the best places to inject it. There's safety concerns given the volume of the local anaesthetic that's being infiltrated. Again, this was shown to be safe, as you heard earlier. And Dr. Mike Gill, one of our anaesthetists, he received funding to carry out the study. And also, there's a large clinical evaluation of more than 1,000 patients led by, this was led by David, and this showed the improved outcomes, particularly in terms of early mobilisation and length of stay for patients. And he's continued to lead in this field and has recently been a co-applicant in a large grant, and also is working on the licensing of the technique which we call the Caledonian technique. And also, in fact, last month published an RCT which he presented today as a poster. University partnerships have been certainly a very important part of the work that we've done, as you'll probably realise from some of the work I've already talked about. We've linked with all the main universities in Glasgow, and especially the Biomedical Engineering Department at the University of Strathclyde. And we have a number of very bright, talented fellows currently working in the department who are doing some fantastic work, and over the next few years, I'm fairly confident that you'll hear more about this. And so this is a link we've established with the training scheme, and so we should have a steady throughput of trainees coming and carrying out work and linked into the universities towards higher degrees. The commercial partnership is also a very important feature of the research that we do, and we have had a number of very exciting projects over the past decade, and in fact our commercial funding has continued to rise, and current expected research income is just short of £1 million. I guess as a specialty, orthopaedics is we work closely with industry, and there is a lot of scope for these funded research studies. And unlike perhaps some of the other specialties we heard from Alan Clarke earlier about the fact that I guess less opportunities within thoracics. So a few studies of note to talk about. This is a study led by Joe Baines, who is a multi-centre international trial looking at a specific type of acetabular implant, so this is the socket part of a hip replacement. And we're one of the largest sites in Europe. It's a 10-year follow-up, and we've now just completed the recruitment of 500 patients, which for a drug trial would not perhaps be seen as a large number, but for orthopaedic trial this is a huge number, and our recruitment rate has always remained ahead of target for this. Fred is the chief investigator in a study that's currently underway, a double-blinded RCT looking at different type of the bearing component of a knee replacement. And this is linked into the university, to Professor Rowe's group in the biomedical engineering department, and it really is extensive, in-depth biomechanical testing, which, using the state-of-the-art facilities that they have available, and has led to the funding of 2 PhD students. And the final one is a study that I got involved with one of the largest orthopedic companies globally, who happen to also be one of the main sponsors for this meeting, and it's looking at their latest and flagship knee implant, where they're really just getting clinical outcome data for this implant. There's 12 sites in Europe, 3 in the UK, and we are the largest centre in this study. And given our very rapid recruitment rate, we were only asked to do 50 to begin with, but because of the speed at which we recruited, it's recently been extended to 200. So again, these are large numbers. So in terms of the vision, one of the things I was asked to talk about and preparing this talk was, what's the vision of the department? I suppose in simple terms, we want to be not only a nationally recognised but an internationally acknowledged centre of excellence in orthopaedics, and that is very much the aim. And in terms of how we get there, already we have growing links with academia, with industry, and collaborations and multidisciplinary research. But I think what is required, and we were discussing this earlier about what it will take in terms of resources. I think it really comes down to giving the support to the appropriate, enthusiastic individuals. And when we were discussing earlier, I sat next to Fred when I think it was Alan Clarke asked about the proportion of research versus clinical work. Should it be 50-50? And Fred said, well, it's always going to be 100-100, because you really do need people who are driven and who really truly believe in it. And I think it's important that the money that's generated in the hospital is fed back into research. I think it's important that hospital supports those who are very active in research. And I think that will help to certainly in our case to realise our vision. I thought I'd finish with a few specific areas of research that we're involved with that I think are quite exciting. First is 3D bioprinting. So this is printing viable biological constructs with 3D printers. And earlier this year, a group in the US printed and successfully implanted into mice these constructs here, an ear. This is part of a jaw, and they maintained their biological integrity. And this is the first time this has been done, and I think it's very, very much the future. We are collaborating with Professor Will Shue at the University of Strathclyde, who is one of the global leaders and pioneers in this field. He was the first to 3D print a pluripotent stem cell, and he is confident that we will be able to print a transplantable bone and cartilage construct in the future. And our aim is to be, we would like to be the first centre to do that. So this is a very exciting project to be involved with. In a very short period of time, we've already acquired an EPSRC grant, and we've purchased a printer. And you can see on the right, this is an example of what we can print. So hopefully you'll recognise this as a nose, which is printed from a hydrogel. And the aim would then be that you would create with stem cells a form of bioink where you would print cells into this construct, and then this would be viable. You could actually implant it. We're filing for an ethics application to obtain mesenchymal stem cells from our joint replacement procedures. Very easy to obtain. You can then multiply them in a bioreactor, and then the challenge is to obviously form the appropriate bioink, and then to print, as I say, a bone cartilage construct. So I think the question would be, how far off are we? I think this will definitely be the future, but the question is how far away this is. But it's certainly an exciting field to be involved with. The technology is going to play a key part of how we carry out these operations going forward. And we, as I said at the start of my talk, Fred is a global pioneer in the field, and this is the area that we want to remain in the forefront of the technology. So, and going forward, I think the robotics in particular will be a key part of what we do. And finally, to finish up with, and hopefully many of you will have seen this, is our newly acquired and recently opened motion analysis facility. This is actually me, it's the first patient, and this is obviously in slow motion. I don't actually walk that slowly.